Well, since I'm the moderator, let me do my duty. And one single line I can tell about Dr. Shanmukh is that he's a futuristic. He was that mission impossible man. He is doing something very exciting to do with nanorobotics. Okay. And I would like my entire discussion to be focused on the futuristic part of nanorobotics, and an MDS doctor getting into Indian Institute of Science. And Indian Institute of Science takes a privilege about showcasing your products in most of the area. So that would be a one-liner introduction of Dr. Shanmukh. And not to introduce about Dr. Rajesh, okay, he is going to govern this, and he is going to make sure that part of this movement of Dental Growth Summit, sir. So that's a brief introduction about sir. And what I love about Dr. Nag is that a hardcore clinician. When I was talking to him, he did mention me that, hey, Vishay, I'm not going to talk something which I don't practice. I don't have such great AI implementation. So I would say that Dr. Nag, he heads the clinical head at the dental specialist, okay, and he's known for his all-tilt protocol redefining implantology. Okay, so with this, my questions would be that first I will go to Dr. Shanmukh. Okay, your company represents cutting edge nanoscience. How do you transform such a deep research into something clinically which can be applicable and used? Because your robot, which is there, it looks very interesting that it can go and double check the root canal treatment, how it is performed. It could be helpful in the preventive part. There are a lot of electromagnetic waves which comes and detect, and I believe still it's in the lab stage. How do you think that it's going to revolutionize when it comes to the clinical adoption and practice?
It's not in lab stage anymore. We are venture funded and we are starting the clinical trials. So it's not lab stage. The good what makes it good is because globally we are the first ones doing clinical trials on it, and the entire nanorobotics company, microrobotics company globally is sort of vouching the scientific community that we are doing it. That's where we are at. And how it's going to change? Well, think about it. How small a surgeon, I'll tell you the thesis why I thought of doing nanorobotics, right? So initially the dentists, from dentist's perspective, even for a ENT surgeon's perspective, we used to perform surgeries with hands. Then we thought if we can magnify things, maybe we'll be able to perform better because we'll be able to see that operation area better, right? Then microscopes came into the picture. Maximum you can do is 12.12x, right? Somewhere around there. And for that you have smaller instruments, because the current microsurgery, that's what they call under microscope, but it's not anyway. But the instruments hold the instruments which are performing the surgical field, right? So they are millimeter scale instruments, and lot of reports have said if you use the microscope with 12x magnification, the clinical outcomes are better compared to doing it with naked eye and with bigger instruments that we use, the conventional instruments. Now think, this is millimeter scale, right? We are working at nanometer scale, so it is 10 power minus 6, right? So it is 10 to the power 6 times smaller than the smallest instrument that you are using in the clinics right now, right? The interactions that we do is actually at dentinal tubule scale. That's what it happens. And it's not just just some drug you have given and just you're forgetting about it. You can control where the drug is going. You can control different operations of it. You can basically excise the tumor, kill a bacteria, bring the nanorobots back, image how things are. And just to tell you the capability, there are a lot of multiple capabilities on top of this nanorobot. One of them is it can sense the temperature of a nucleus of a cell. One paper we have published where a nanorobot is actually moving inside a live cell and it's measuring the temperature of a nucleus as it changes. So I know it all sounds very, if you are into scientific field, might sound okay, fine, that's a good achievement, but if you are not from a core clinical part, it sounds like outlandish, but that's where we are at. How is it going to improve the outcomes? Well, imagine this, right? Okay, maybe there is a segment on AI and nanorobotics, right? So I think maybe I'll expand on that. But just by going 12 times the magnification, you can do better. Imagine going at a magnification of 10 power 6. Now, it's not just a order jump, it's 6 orders jump, right? Think about it, how much precision you can get and how much better you can be. It's your nanoscale extension of a dentist to a inside a tooth. Think about it that way.
So, in a very cut short, what he went about is his nanorobot move very precisely. It goes about killing the bacteria by heating up the magnetic field. It can go quite deeper, better precise than the laser and ultrasound.
Well, laser ultrasounds, you don't have control, right? They are still macroscopic instruments. You are expecting it to go. I mean, it's a very deep science question. I love to explain, but it can kill bacteria. It can also build the tooth. That's the latest paper that we published. It got published 2 months ago in a very high impact paper, about 15 or 16 impact. So basically think about it this way. And the reason I'm bringing in the impact factors, because of course you publish a lot of papers, but to get published in a paper that is 15 and beyond, you literally have to make a dent in that field, or else you cannot publish in such high impact papers, right? So it is changing how the treatment is being done. And a lot of people think, okay, this all sounds very fancy, it all sounds, because a lot of people have heard about quantum computing and all, but we don't have any quantum computers in the room yet. But just to give you the reality check.
Can India lead the world in dental tech when the person sitting beside you is talking global? It's like most of us might have heard this as a very futuristic thing. So can India lead the world in dental tech through affordable innovation? Okay, and what you or the ecosystem can come together and help to address that gap in terms of affordable technology ecosystem development in dental space. Your thought, a very free thought.
Yeah, thank you, Doc. So it's been, joined my dentistry in the year 1990 as a BDS graduate, then finished my master's in 2001. And if you see this 25 years, so when we started off, when we got into MDS, the material which we were using was totally imported, including our pliers which we used. So I'm trying to be more specific with my area of dentistry, that's orthodontics. But now you see, from brackets to pliers to wires, everything you get it here, it's much cheaper. So when something like the innovations come up, the material becomes cheaper, that definitely, and we give a better treatment with affordable price to every nook and corner of the country, the more remote area also, then we'll definitely lead. See, it's all about reaching to the people. It's not that we're treating only the cream of the people. So that's what you're asking, right? Whether we can. So the more you reach to the public, the more you reach. Say we live in a huge populated country, and most of the people in the country are not affordable, they cannot afford the treatment. But if we can make it more cheaper and reach more, that is, it's not about money, it's about reaching to the number of people. That is where we should lead.
Okay. So Dr. Shanmukh, how many such people like you are there in the ecosystem who would be able to go and incubate in those kind of dental tech park? What's your blank idea?
I think the first question is India ready to lead the, right? That was, I think India, let alone India, Southeast Asia is not ready to lead dental innovation. I'll tell you why. Because there was most of the dental materials that we use, nano materials, nanoparticles based, right? Anything, say zirconium or anything. There is no, to commercialize a nanoparticle based cement for dental cement, a very basic thing I'm telling you, need a GMP facility, right? Good manufacturing practice facility. There is no GMP facility in entire Southeast Asia. Innovators like me would love to come and incubate in specifically in dental. I think it would be great. But one thing I want to tell you, if you really want to sell innovation, right, you just can't be a one up and say I'm going to sell this. I mean, there are some venture capitalists also, that's what I've heard. No VC is going to put money in a technology which is just one up. Only reason technology gets backed, venture backed in India, two ways. One now is either you are globally, you are the first one doing it. Second one, you can scale the existing technology in India. So these are the two segments, that's how it works.
So Dr. Venkat now has been sitting quite quite patiently. So, Dr. Nano, your TTPHIL protocol, it broke the conventional rules in implantology. What, in your view, truly defines innovation? Because is it adopting the technology or agreement?
Hello. So it's a combination, but it all started with the feedbacks of my patients. It's all about the failures in my cases. And I used to work in one of the charity hospital, Mahavir Hospital that time. There was nothing, we used to get dental implantologists from US when sir used to call, and I used to assist even till 1 o'clock in the midnight. So next day, the doctor does the whole treatment and he used to leave. And I used to hear all these scoldings, or can say the feedbacks from the patients, where I used to understand the major problems which used to happen with the grafting and invasive procedures. So that's how it started, where I started rethinking, learning, as we all know, learn, unlearn and relearn. So we need to think about the patient's perspective at the end of so basically I started looking at, because I'm a prosthodontist, and every person who was there in my faculty who used to treat the patients were all bone surgeons, and we never used to think about blood. We never saw blood in our post-graduation. So doing the suturing also was very difficult for me. So this, when I started looking at the feedbacks and my own failures, I started learning about it, but my hands were never trained to do those aspects. So I thought something which we have to look at, something minimally invasive protocols. And these patients, once they were treated, because it's a charity hospital, they used to get the treatments done, but I call them up and speak about future referrals. So they never used to refer those kind of patients for there, because they already underwent a lot of trauma. So in this era where we are looking at patients, where they think about 4 different things: less pain, less risk, less time, and less investments. So we need to focus on these 4 if you want to grow at a higher level. So it is not just for the patients, these 4 things are for us also. Less risk is what we have to look at as a dentist. Less time, so that we can see multiple patients, and less amount of investments, where we don't need to buy something where we have to push the burden onto the patient. So we have to think about something minimally invasive protocols. So that's my way of thinking. And to be frank, more than marketing, our patients are the future. Referrals for us. They are the brand ambassadors. I treat every patient as a VIP. And the patient who is accompanying the patient is also important, because we think only 1 patient or 2 patients, where I used to start my practice. Only 1 or 2 patients, they used to come for scaling. And I used to treat the adjacent person accompanying them, who comes almost like for a kid. More than 4 to 5 persons come. And those 5 are also our patients. We need to think about it. So we never focus on the attendants who are accompanying the patients. So those are also very important. So that's how we need to look at it.
The AI is now predicting cancellation. It is automating the workflows, helping in the follow-up. So in your practice, have you seen any measurable benefit through such AI adoption from the patient experiences? And Dr. Srinivas, I would like to see that. Where do you see the robotics, making its first real impact in Indian ecosystem? Maybe implants, think about this, surgery, and how the clinic should be prepared to adopt those new innovation and adoption. So it's you're getting the clinical side, you're getting patients. So how would you like to answer? Yeah, I will get started.
So, AI, to be frank, right now in this field, only for practice management where we can convert our patients, showing before and after, probably it is helping, but digitization is playing a vital role in my practice right now, where I'm the last person to incorporate something which is new to my practice. So, mainly for patient conversions, it is helping, and digitization with follow-ups, feedbacks. Right now, it's helping for me, and probably the prosthetic aspects in implantology and before the surgery, the diagnostic aspects. It is definitely helping and simplifying my protocols. So, to be frank, because of this, now without even taking scanning, we do give the teeth on the day one. That's called one appointment protocol, where we finish without doing even the scanning. So we are able to get everything in one appointment. So their teeth are prefabricated, and we are able to give the teeth even in day one. Probably it's not. I'm still working on it for full arch rehabilitations, but for single tooth, multiple teeth rehabilitations, we are able to give solutions to our patients.
So it also helps in your revenue.
Yeah, definitely yes.
And what do you from the clinical side?
Well, two things. One is AI, second one is robotics. Both, right? So first one, AI. I think what Dr. Nag meant was digitization, right? So it's making things go faster. But see, the problem with how AI is impacting any workforce right now. For example, if you run a clinic and you want to have an experienced doctor who can just look at an X-ray and tell what the problem is, you need to spend time, you need to find a person. So what AI is doing, it's actually demonetizing the talent. One AI agent can work tirelessly for 24 hours and can actually give you the same result what an experienced 10-year-old radiologist can do, but AI is still sort of a little bit failing in that, but still that's where it is. Now, AI in automation, it won't work, because the problem is a lot of people, a lot of good colleagues across, if you know, there are some companies like Overjet in US, they are like Overjet and Pearl AI, they are raising billions of dollars, and they are trying to automate the scope to the founders. So what they're doing is you just scan it, and all the thing what a dental technician does, basically building that process, everything is being automated by AI. But they are not able to do so even with billions of dollars, is because AI starts to generate things, and anything that is generated by AI, there is always an artificial part of it that is not relevant to the physical scenario. So that needs to be bridged down for AI to basically take over the automation. Digitization has to still be done by human beings. But yes, the mundane tasks like appointments and automatically scheduling, this is very stupid task. You don't need AI for that, but people are still using it just for selling it. So that's where AI is. Now, talking about robotics, what is the first thing? That's the question, right? So this is a very conscious decision that we took. We are working in brain cancer, glioblastoma, nanorobots. They go inside the brain, they find the cancer, kill the cancer, come back. This sort of stuff we do. The problem is, whenever a new hardware technology comes to the market, I just cannot come to the market and say nanorobots are going to heal your brain. It takes time. People to accept a new technology. Right? So we have been told the best segue is to go for a problem that is very general. Right? If I go and tell any general public that is the problem I'm solving, they understand. So, and of course, these days the current trend is preventative medicine, not interventional medicine. So if you can prevent something even before it happens, or if you can rebuild something that has been lost, there definitely is a big market for it. So you will be finding nanorobots in your clinics actually rebuilding the tooth. In a very, and it's very, don't think of it as a very complex procedure. We are making it foolproof, and I'll tell sort of, I think I'm assuming 95% of the people don't know what we are doing, right? The sad part is there are companies from US, companies from UK coming in and approaching us to license this technology out. Even before and it is being done in India, just 500 kilometers away from here. And those companies are coming and saying, we're going to license technology out. It will be under our banner. So of course, we have to survive, we need money, we have to do it. But I feel sad that the first product that is being purely developed in India will be marketed by some US or UK based company. Now, leaving that aside, the first nanorobotic product in the market will be used to build the tooth that is lost by the patients. In a very simplistic manner, we just put the nanorobots there, activate the device, they go in, they build the teeth wherever there is loss of anatomy. So that's good. Other use cases will come. And lastly, before I know I'm taking too much time, last thing, AI and nanorobotics. So imagine a scenario where, for example, you have made a perforation in the tooth, right? You can go CBC, exactly find out where in 3-dimensional space, find out where the perforation is, right? You put the nanorobots inside the canal. The AI is going to guide exact the 3-dimensional position where the perforation is. The nanorobots are going to go to that exact location. It's going to rebuild the tooth that is perforated, and you don't have to do anything. Just put the CBCT in the software, put the nanorobots and just activate them and just let them do their work. Imagine a dentist now. Again, I'm trying to bind everything together because I think these are remarks. Give me 30 more seconds. Question is, how nanorobots are better? How it's going to change things, right? Imagine you have made a perforation. Imagine now taking a file, putting this bioceramic, trying to push it in. It's so messy. You actually don't know where it is going. Now imagine just taking a CBCT. This is just one example I'm giving. Putting it in the software, putting a solution of nanorobots, and just let them do their work. In 20 minutes or so, the perforation is completely sealed precisely where exactly that perforation is. Right? How easier the life will be. So that's where we are. Thank you.
Which will help clinicians and startups to partner better to test and scale this solution.
So, see, this is mainly regarding the endodontics treatment he was discussing about. Recently, a patient came, as he spoke about a perforation, the root canal. The patient was not having any relief even after, in spite of doing a lot of work on it. So we took a CBCT in-house where, and we were not able to locate exactly even in the CBCT. See, you need some software where these robots have to act on, and CBCT is really not very precise. To be frank, it is in implantology. It is, if you see actual length of the bone, it is more than 2 to 3 mm, which is a huge when compared to robots. Okay, so we are speaking about a very minute thing, but everything depends on a software. So without the software, probably even you cannot calibrate anything. So how good is CBCT to test the nano robotic technology? Because CBCT itself is not correct.
Okay, so CBCT, how good it is? Of course, we work in micro CT. It cannot be applied on the human beings. The reason we even will go to nano CT as well, that is more precise. Then of course, anything that you are converting from analog to digital, there is always a error that happens, plus or minus, right? But I mean, this is just one case example that I have given, nanobots for perforation and all. But the thing is, here's the thing: if you can even know that where the perforation is by tactile sensation, right? With a file, if you can tell where exactly it is. You can actually, otherwise, you can put the nanobots in the root canal, right? And you can guide them with the help of a joystick, right? It doesn't need to be controlled by AI, right? So nanobots as such, you can control the whole swarm of millions of nanorobots using a joystick exactly where you want to take them, and just like playing some video game. CBCT is where you're completely automating the whole thing, but that's not required. You can do it with your joystick and manual controls as well. So yes, I mean, I completely agree with Dr. Nath. CBCT is not 100% all the time, but currently that's the gold standard of visualization in dentistry. If you think error is so minute that even gold standard cannot be precise enough, then we have to depend on human being. And if you think human being is also not good enough for it, well then it's always God, right?
So Dr. Shanmukh, one question final. Disruption. I'm sure you might have read about the Japanese news, like the tooth regeneration becomes clinically reality.
Yes.
How should be the dentist be prepared for this particular paradigm shift? And I assume by 2050 or 2060, there won't be anything for dentists.
No, I don't think so.
I never said okay.
So, no, don't worry. So there is this professor by the name Takahashi. He's from University of Tokyo. So he basically, this technology, okay, I don't want to use that word for me. So there is something called as USAG1. That's the name of the protein, right? So what they are doing is basically that USAG, what it does, it's the one which gives a stop. Right? For example, there is a tooth bud. All the bone morphogenic proteins. If you're from periodontal department, you know this even better than me. There are bone morphogenic proteins which belong to TFG superfamily. Anyway, so these bone morphogenic proteins, what they do, they actually guide the cells and they make the cells divide. Basically, they help in making the tooth. So what this USAG1 does, when the tooth is formed, it stops the BMP proteins to form the teeth. So what they are doing, it's very simple. They are just knocking off the USAG1 gene protein. They are stopping that protein to work. The moment that stops, the BMP will again get activated and again that new tooth will be formed. But this is something you guys should know. Everyone should know. I have so many, no one has actually even read the paper. They are saying it will become a reality. So what they are doing is, in third molars, right, you have these tooth buds, right, which are unerupted. Or in case of supernumerary teeth, you have these tooth buds which are not erupted yet, right? If you knock the USAG1, the BMPs will come again, and whatever the tooth bud that is not erupted, it will form that tooth. So most of us have tooth buds in third molar. So this tooth regeneration will work only in third molar. Now, for example, a person's front incisors are gone. You cannot put a third molar there and say it's going to, right? So it is not what it is. It sounds very fancy, but it requires a tooth bud, right? And it will work only for supernumerary teeth exactly where the tooth is required. So if this, for example, tooth bud is in third molar, you cannot put that in incisor. You again have to be basing it on some implant or some prosthesis.
So my final question is, let's close your eyes and assume that we are in 2040. Your nanorobot and other discoveries are licensed, paper and optic. And Dr. Nanak, you have multiplied from 40,000 to 4 lakh square feet retail dental space. And sir, you have reached that particular stage wherein you can influence good for the dental fraternity. Let's assume that and try to answer this question. Okay. Imagine implant clinic by 2040. What blend of surgical precision, digital tools, and patient experience will define the success? Okay. What would be required from the surgical precision, digital tools, and the patient experience during those days?
Okay, 2040 probably it's too late because now technology is improving, technology is getting copied, technology is being duplicated. Anything can happen. We don't know what's going to happen in 2040, but at the end, whatever is the technology, it's a product based, yes, a lot of things, but our dentistry is service based. So whatever technology is increasing, we need to have the touch on the patient where we need to, that empathy, love to our patient, where we need to tell our patients, which AI cannot tell, where I'm there for you. If there's any problem, I'm there for you. So this is probably, even after 2040, we may not get this kind of technology. Simple as any kind of car showrooms where now they're coming up with so many new technologies. If there is no service center, will they purchase? that card. So I feel the technology is technology, skill is skill, and love is love. So that's the difference.
So how do you visualize that?
I always say the technology should be controlled by human brains. So your dentistry should be, see anything, any patient walks in any field of medicine, it's about diagnosis. Without diagnosis, the machinery can't do anything. So I hope the robotics or AI, whatever it is, which is should be controlled by the dentist or human beings.
By 2040, see, the thing is, it can affect multiple ways. First, the physical, the digital, so many ways, right? So, first thing is, as human beings, as we are evolving, the smaller the things, the more precise precision we have in doing things at smaller scale, the more advanced we are. Like for example, the size of the screen was about 1 MB, right? 30 years ago. 1 MB is much big. Now, small, this one can hold 1 TB of space, right? So they are making all this three-dimensional space, whatever. So, the more smaller we get, the more we have to get. If we want to evolve ourselves, we should be able to package technology in smaller space. That's most, partially. So, right now with nanorobotics, we are trying to reach a control up to nanometer scale. So, the more precise, for example, if you do composite, macro leakage happens, nano leakage happens, because you can't control macro leakage. There was a problem. Then again, nano leakage came into being. You cannot control nano leakage with hands. How do you do that? Right? You need to have that precision control at nanometer scale. I think that will be possible by 2040. Now comes the digital part, the human mind, right? See, ChatGPT was introduced to OpenAI. You won't believe it happened just 3 years ago. Now imagine the sort of things that it is doing. Every day it is developing. Now again, I have to bring everything together to have everything. So the problem was the servers, because you need more servers to train an AI. There's a lot of problems with it. Now people are basically trying to find a new way of computing so that the server problem is solved, the compute is solved. So I think by 2040, ample amount of time, I think next 15 years from now, I think we will be able to reach at least a human intellect making machines will be there. I'm pretty sure about it. Because I sort of work and collaborate with scientists from Cambridge who work on Google Brain, right? That's and they are doing amazing work. I mean, what you guys know what ChatGPT can do, and what the current AI is doing is basically, you guys have no idea what it is doing, right? You will know when it comes out. So I think by 2040, by far, we will have a human decision capable artificial machines doing it. I'll tell you what will happen to the dentist. Right? I think we will become, as it evolves, as we are evolving as dentists, we will become super dentists. I'll tell you what. We will be able to control material at nanometer scale, right? We will be able to double check our decisions using AI that if the decision is correct or not, right? So I think our treatment, what we give to the patient, will be far better compared to what we are giving right now. This is not the limit. We are pushing ourselves from material aspect, from decision making aspect. So that's the future where less patient, more satisfied patients. And of course, you need some love, like what Dr. Nath said. So, yeah.